Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, practice, and policy. And each month, we select an article to feature as a press release with an accompanying podcast. And today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today I'm speaking with Dr. Megan Mueller, who is the corresponding author for the article titled Impacts of Parental Food Choice Values on Children's Restaurant Eating Behavior Among Low-Income Regular Restaurant Consumers, a Latent Class Analysis. So Megan, I'm really glad to have you with us today. And can you tell us a little bit about yourself?
Yeah, thank you so much for having me. I'm honored to be here. Love the journal. So grateful to have this work featured. So a little bit about me. I am an assistant professor at Colorado State University in food science and human nutrition. And the overall goal of my research program is to apply systems thinking, policy relevant, community engaged, and equity oriented research to tackle chronic disease and food insecurity in families. And a big portion of my research actually has been conducted in the restaurant environment since restaurant meals contribute substantially to excess calorie intake. About a third of adults and kids eat out in quick service restaurants on any given day, and approximately half of the US food dollar is spent on food outside of the home. So it's a critical target environment for chronic disease prevention efforts in families. And then in recent years, my research program has expanded to focus on health equity and food insecurity through collaborations with my community partners. And I started the Systems Thinking in Obesity Prevention Lab at CSU in 2019.
Wow, nice. I'm
Yeah,
real glad that
thanks.
you started that.
Yeah.
So, can you give us a brief overview of the paper, including what you did and the results?
Yeah, so this was actually my first master's student's thesis project that
Wonderful.
then became a research paper. So Jenna Bensko was one of the original masterminds behind this project. And she was really interested in sort of food choice values and how that relates to people's behavior. And so we took a somewhat unique approach by looking at things that a lot of people had looked at before, like taste, cost, and convenience. We always hear about those being primary drivers of food choice. Karen Glanz's work is a good example of that, one of the initial studies. But we had never really seen a paper that had looked at food choice values in the context of sort of value systems. So, how do people prioritize different values together, and how do they trade? What are the trade-offs that they make as individuals? And so that approach was, of course, informed by Jeff Sobel's food choice process model. And we used a method called latent class analysis to essentially understand how these values hang together within parents, and then looked at those. So with latent class, that you are able to identify subgroups of folks based on whatever indicators you're interested in. In this case, we were interested in values that parents had around an eating out occasion, a recent eating out occasion. And we were able to identify 3 different subgroups based on the things that they prioritized. So our 3 groups were indulgent consumers, hassle-free consumers, and multifaceted consumers. And our indulgent parents were those who, or I'll say they all prioritize convenience, but our indulgent consumers also prioritize taste. Our hassle-free consumers prioritized convenience, and they just didn't want to cook at home, which we've all been there. And then our multifaceted consumers, this was actually the class that I would say took the longest to figure out the name for, but they kind of prioritized a lot of different things. So convenience was still a priority for them, but they also prioritized things like nutrition, wanting to support their local businesses, and a number of other things as well. Food safety was also a priority for them. And we found that there were differences in how these groups of parents ate out, basically, how their children ate out. So our multifaceted consumers, those that prioritized kind of all the different things, they tended to eat out more frequently than the other parents subgroups, and our hassle-free or excuse me, yes, our hassle-free consumers also tended to have kids that were more likely to order a less healthy entree than our other groups. And then we also looked at things like food insecurity and stress, because as you said in our title, this is specifically low-income parents during the COVID-19 pandemic who prior to COVID-19 ate out frequently. And so it's a kind of a unique group of parents. And so we felt that it was a group that was sort of missing from the literature. There's a lot of there's a lot of research out there right now about eating behavior and COVID. A lot of people did surveys, but this is a very unique group. So
Excuse me. Great. Thank you. And as I was talking to you before the podcast, what really drew me there were several things that drew me to this paper to highlight in the podcast, but these looking at parental values through this value systems approach is really unique to me, and I really it's interesting. I could relate to some of the characteristics of all of these groups that you had highlighted, and I thought a lot about how I am when I go out to eat. So this has been very interesting for me, and you mentioned COVID. Um, how do you think, or do you think, any of the findings from your work would differ if you were to ask parents now post-COVID about their food-related values and their children's eating behaviors?
yeah, it's a great question. I think so a couple things. So because we were specifically interested in what we're calling habitual restaurant consumers prior to COVID, we sort of posited, although we didn't know if these folks would change their behavior during COVID, because as we all remember, it was such a huge shift for so many households, so many people. And interestingly, while just looking at our data, some of these families did eat out less frequently, at least
Mhm,
during the period during which we asked them about their eating out behavior. So on average, about 2 times per week versus the 3 times or more per week prior to COVID. They
mhm.
still went out to eat. So these are
Sure.
not the folks who were completely shifting everything, right? Which is maybe not that surprising given that they were, as we said, habitual restaurant consumers prior to COVID. And also, they have kids and they're doing school at home and trying to work if you have multiple working parents in the household or caregivers in the household. And so it's a lot to manage. It was a lot to manage for every family. So we don't, of course, we don't know if things would change, but we could sort of posit that it might not change as much just given that their behavior didn't shift
Mhm,
significantly during this period. However, that being said, I think it would be very important to, interview these parents again, survey these parents again to understand if if some of these value systems classes that we were able to identify are still the same, and even to expand beyond this population, if we wanted to understand parent value systems in a larger swath of parents, I think that would be important too. So it is possible that we would see some changes. However, because they're habitual restaurant consumers who still eat out multiple times a week, I don't necessarily think we would see a huge shift. And then also another thing to note is that taste, cost, and convenience were priorities for a lot of these parents. And that's something that we've seen for a very long time in the literature. And so that wasn't necessarily a surprising finding, but it also speaks to how prominent and important those factors are still, even during a period like COVID for families. So,
sure,
but yeah.
absolutely. Those are the three biggies, right? Taste, cost, and convenience.
Hmm.
Um, So, another really interesting part of your work was that your research suggested that parents in the hassle-free consumers group are more likely to order less healthy options for their children. What kind of strategies do you think could help you to kind of target this group and encourage healthier choices when dining out?
Yeah, so the hassle-free consumers again were those that focused not just on convenience, but they just didn't want to cook. And so for those folks, meeting them where they are, they're still going out to eat on average 2 times a week. By encouraging and improving what's available in restaurants, I think that's something that could really reach this population because you're probably in doing a cooking intervention going to have a harder time. You have to convince them that cooking is fun, right? And so they're just going to be, theory of planned behavior, maybe not quite ready to make that shift. And so, how do we meet those families where they are? I think a great way to do that is by changing what's available in the restaurant environment, encouraging restaurants to offer healthier options to kids, to families. And in some of my previous work, we've seen that there has been some shifts actually, especially in terms of sides and beverages on children's menus, where there have been some improvements. The majority of literature shows that most of these meals still are not great, but there's some improvement. So that's promising. Hopefully, with policy changes and other um, uh, what am I trying to say? Um, you know, uh, consumer-driven movements, I guess. Yeah, consumer-driven movements. We can see some shifts. There's a lot of very active advocate mothers out there, for example. And so I think there's some pressure in the industry to see some changes. So that's one way to reach them. These parents were also likely to have high stress levels. So any kind of strategy that can help them manage stress, that has been shown, at least in adults, to have an impact on food behavior, eating behavior. And so, and in our case, we're seeing some sort of translation into what kids are ordering as well, which we don't know if that's because of what their parents are also ordering, but it might be. And so that's another thing to think about is stress. But yeah, focusing on convenience, staying in the restaurant by promoting healthier meal choices through either promotions, including healthy defaults. So what automatically comes with meals is healthier in terms of sides and beverages. Interventions that don't just provide calorie information on menus, which is what we have based on the Affordable Care Act, menu labeling, calorie labeling, but also promote things like taste and convenience of healthier menu options, I think could also be a great strategy to reach these families.
I think there's plenty of strategies, and you've given us some great ideas there. And what a wonderful way to lead off with your first master student's thesis project. You've set quite a foundation for moving forward in a very important aspect of the field. So kudos to you and to your student with this.
Yes. Yeah, well, I think that's like one of the benefits, right, of being a faculty member is getting to work with these amazing, very motivated, intelligent students. So I feel very lucky that was my first experience.
Well, both you and your student have done wonderful work here, and I really appreciate you spending this time with me. Is there anything else you'd like to add?
Yes, well, I would love to just again say thank you to my student Jenna Bensko, who I wish she had stayed on for a PhD. But I'm so happy for her. And then my colleagues and co-authors, Dan Graham, Sue Kong, and Eli Mui, who were very instrumental in asking the hard questions and pushing this work forward, and also the reviewers. JNEB has amazing reviewers, and I just think that all papers become better through this process. So I'm very grateful for that too.
Well, and thank you for that plug for JNEB reviewers. They work real hard, and I'm always glad to hear an author send out a little kudos to them as well. So thank you for that. And to all of our listeners, remember, you can read this article in full at www.jneb.org for free for the next 3 months.